joining. Okay. Very good evening, all of you who are joining us from India, and a very good afternoon to those who are joining from Bray's side, from Cornwall, UK. This is Homeopathy 360. I am Dr. Rashi, your host for today, and this episode is going to be a little special because Beyond Boundaries with Homeopathy 360 has literally gone beyond the territories of India all the way to United Kingdom, Cornwall, and I am glad to welcome Bray Williamson. He is a classical homeopath, practicing classical homeopathy for a long time now, and the author of the book called A Simplified Guide to Homeopathy. So, welcome on the platform, Bray. Um,
Okay,
before before Bray begins, quickly I'll acquaint the audience with the interface. So you have the Q&A box at the bottom of your screens. When Bray starts with his lecture, you might find some questions, some queries haunting you. So you can go on typing your questions in the Q&A box, and in the end, when he concludes, I'll take up the questions one by one, exactly as we do always. Uh, so I am handing over it to Bray. We'll be talking about the very basic fundamentals of classical homeopathy, case taking, and unprejudiced observer. The two fundamentals that you require to make a successful prescription. So over to you, Bray.
thank you, Dr. Rashi. That's a very kind introduction. First of all, I want to thank the Homeopathy 360 team for giving me this opportunity, and welcome everybody who is here to
Thank you.
hear
It's absolutely our pleasure.
So, first of all, the most important part of homeopathy is case taking. Without a case, there is no homeopathy. You can know all the materia medica, all the repertory work, but without a case, you do not know the true picture of the disease, and therefore you cannot prescribe. For students, this can be a confusing area because there are so many different things that one has to be aware of when fulfilling Hahnemann's idea of the unprejudiced observer. Prejudice is, in this term, is not the big prejudices, such as prejudice of race or gender or religion or sexuality. Somebody who had those prejudices shouldn't really be taking a case. They should be looking to have their case taken in order to deal with those issues. When we look at the different areas that can prejudice how somebody takes a case, one are triggers. People can have their own triggers. So a patient can come, sit down, start talking about their problems, and it can trigger something in the homeopath that they haven't resolved themselves. Because none of us are the finished article. We all have things that we're still working on and growing with. And those triggers can be such things as infidelity or domestic abuse, lifestyle choices. I had a student many years ago when I was doing cases with students who came to see me really quite distraught because they'd had somebody come to have their case done, and the gentleman sat down and, as part of the case, expressed a desire for children in a sexual way. And this student came in to me and basically said, as far as they were concerned, this person's remedy was plumbum, and it should be a plumbum 9mm into the head. I said, look, this is not how we look at things as a homeopath. First of all, you must bear in mind this person has come for treatment. They realize that these thoughts are wrong, and it's your duty to treat them and cure them. And if you wish to be this protector of the innocent, curing this person is the thing that will do it. But in the end, I had to take the case because this student just could not get past that, and they needed, obviously, to work on that themselves. And that's how triggers can cause a reaction that's negative within the listener, prejudices the case, and means that you cannot prescribe for that person. Another area that I've come across over the years is a simple thing of projection. So, for example, if another homeopath comes to have their case taken, it's not unusual for the prescriber to consider that the homeopath will have a more knowledge about the sort of life issues and the things that would be bothering them, and kind of accept very much at face value what's said to them because of this projection that they are also a homeopath. Unfortunately, that's not the case. They've come because they have pathology that needs work on, and you have to treat everyone the same, whether they be a homeopath or not. And I've always said to my students, a king or a pauper, you must always treat them the same. You take the case, and from there, then you go on. One of the things I've noticed recently is there's quite a modern projection where people have, with all that's gone on over the past few years, with vaccination. So you have, I've had a number of people talk to me about this, where they have very negative views on vaccination. It's not something I particularly agree with myself. However, they're projecting then onto patients that the fact they've been vaccinated is why they are ill before they've even taken the case. And clearly, this is incorrect because it could be any other reason. The illness could have been going on for years before, but this is a projection that seems to be becoming quite prevalent at the moment, and one that really needs to be avoided. We have to take cases thoroughly and properly. Another area that I've come across very frequently, especially in students' cases, is assumption. The assumption that they have understood the case. So, for example, you have a lady comes to have a case taken, complaining of anxiety and say some agoraphobia, and the homeopath will ask, when did this begin? And the person says, well, it was when my husband left. My husband left me 3 months ago, and ever since then, I've been suffering from this anxiety and this agoraphobia. The assumption would be, oh, that's the fundamental cause. The assumption is the husband leaving has triggered these symptoms. However, for a unprejudiced taking of the case, without assumption, one must ask, have you had this before? Have you suffered from this anxiety before? And then the lady says, well, actually, yes, I did have it when I was a teenager when my father left the family home. So you go, now I've got it. Yeah. So the father left. There's the fundamental cause, because now we have a pattern. We have a pattern from the husband and the father, this abandonment. But not to assume, one must ask again, have you had these symptoms prior to the point where your father died? Once again, you get an affirmative answer, yes. when I was a child, my grandfather died, and I suffered from anxiety. So then as the homeopathy, I've got this absolutely sorted. It all stems from them. There's the fundamental cause. Let us move on from here. No, that is incorrect. We must ask again, was there a time before where you suffered from this anxiety or from anxiety similar to this? This point you can often find, this is where the silence comes in the case. The person will become quiet, may become quite introverted. Before they were happy, this is a story they've told in different points and times. Where we are now, this is where they've never, the truth they have not revealed before. And then after some time and remaining quiet as a homeopath, not asking more questions or supplementals, because we know the possibility is that we would let them away, because, and go back to our assumptions, the person tells us that prior to 6 years old, they were perfectly healthy, perfectly happy. But at 6 years old, they were abused by their uncle. And there now we have the fundamental cause. It is not the husband leaving. It is the trauma from when she was a child. And so assumption must always be avoided when taking a case. You must always continue to ask to get to the depth of where the pathology arose. Another area I find that prejudices cases, and one that I've heard a lot, is empathy. This wonderful term, empathy. We have a number of people I've met over the years who say, I'm a very good healer, very good homeopath. I empathize with all my patients. Yeah. Empathy is the sort of concept of being able to feel the feelings of others, to understand and feel their feelings. But you're not feeling their feelings. You are feeling your feelings about their situation. So, although those things may be similar to some extent, they're most definitely not the same. So, if you then use the empathic or the empathic feelings that you have as part of your case analysis, you are not prescribing for the patient. You are prescribing for yourself, as well as their symptoms combined. And so once again, this whole idea of empathy must be avoided. We are not there to make friends with the derangement and the disease state being expressed by this person. We are there to remove it. So, empathy should be avoided at all costs. It's very much a negative thing in case taking. And what we should always do is remind ourselves that what we are seeing in this patient is illness. It is a derangement of the vital force being expressed, and therefore something that through our work we will change. When they come again, they will be a different person if we get the right remedy. And we can only do that by a good case taking. Another area that I find has grown more over my sort of 30 years in practice, and something that I think can be quite damaging for students, most definitely, are systems of case taking. If you have a system that you stick to for every case that you take, what happens is that you have your first question and your second question and your third question, and so on and so on. You're not listening to the patient. You are not allowing the flow of information to come from them, you're thinking of your next question. And if you go through your check sheet at the end of the day, you'll go, okay, well, if you're lucky, you will have half a case. Also, these systems can really put off a patient. I've seen things where every single woman who comes to have a case taken is asked about her menstrual cycle. Well, if she's come with a sprained wrist, why does she need to talk about her menstrual cycle? Yeah. And so, yeah, systems I think should always be avoided. We need to be, able to treat everyone as an individual and every disease state as an individual disease state. And so move as is required with our questions. Another area that I see within these systems are people using combination remedies, where they're mixing homeopathic remedies, which obviously, in my view, is not homeopathy. But one of the things that they seem to do is they will take a case, and as they're doing it, they're totting up the different remedies. And they will sit and ask a patient, because they're going to give them 5 or 6 remedies at the same time, to give them another symptom so that they can pick another remedy to put into their little pot of madness. But once again, this is not taking a case. This is working on a speculative system that is not going to create cure. Another area of systems that is a personal slight bugbear with me is, and I've written an article for the next homeopathic heritage on this biochemic medicine. I've seen where homeopaths have gone, right, so no matter what case comes in, I'm going to give them tissue salts before anything else. I will pick however many, and this is the system I use. The people, they come, they get their tissue salts, and then after some time, they may get a different remedy if they're lucky. And the problem here is, if you think of a broken clock is right. It tells the time twice a day correctly. So in using this system, they will hit on a constitutional remedy through no fault of their own, and a patient will recover. And that to them then is proof their system is working. When everybody else who's taking it, they don't get better at all. But, they focus pretty much on the very small successes that they have. And it's, as I've said in my article, it is not homeopathy. It is a use of 12 homeopathic remedies. And they're only really correct if they are constitutionally prescribed. Another area that prejudices a case, it's a most common one, is when somebody is taking a case and they're already thinking of rubrics. They're already thinking of, what they're going to put into the repertory. Once again, that prejudices the case because you are no longer listening. You are now not listening to the patient. They could have, while you're thinking of this rubric, they could have told you something so important and so fundamental to the case that you missed completely. And so one of the things I always say to any students is, if something like that does pop into your head, just make a little note of it and ignore it and carry on. but do not look at it, do not go back to it, do not even recognize it until the case is finished and you are going through the case properly to do an analysis. Because if you do, you're very liable then to start asking leading questions, questions that start to move into that area of the repertory that you think they're at when, quite simply, they may not be. And this also occurs, I find, with people who concentrate very much on, say, materia medica. Now, I know for a lot of students, materia medica it's great because you can learn about the remedy, you can have keynotes, and you know this and you know that, and it's I imagine that in exams or tests, knowing your materia medica is very important. However, when you're taking a case, it is not at all. You do not want to have any thoughts of remedies. And if a remedy pops into your head, treat it the same as a rubric. Just note it, forget it, because otherwise the same process occurs. You start asking questions that sort of lead towards a particular remedy, and that is not giving you a full and accurate case. You are prejudicing it with your own thoughts. And to be perfectly honest, it's impossible for anybody to know every remedy in the materia medica. You cannot know everyone back to front. That's why we have these wonderful books. So put materia medica knowledge away, off to one side, listen to the patient, let them tell you, and through their voice, through their movements, through their body language, what is deranging their vital force. Just let them tell you. And then once you've done your analysis, then it's time for repertory and materia medica. Now, there's another area that I know many people kind of struggle with when they're taking a case. And that is when people come in with their allopathic diagnosis. You can have, say, two people who make contact to have their case done. One expresses that they have an abscess in their mouth, a very bad one, and the other that they have stage 3 cancer. Now, because of the weight of emphasis that can occur through an allopathic diagnosis, with this particular thing, one of those patients is going to die very soon, and one of them will live for many years. And it may surprise people when you look at this, that the person with the abscess, it can go very badly. They could get septicemia. They could be dead in 24 hours. The person with the cancer could live for 10 years. And yet there is this weight of emphasis that has occurred through allopathic diagnoses that many homeopaths would go, oh, well, the cancer is like a much bigger thing to treat. It is much more important because it sounds like a scarier illness. But really, it's just a set of symptoms. It is just symptoms. And that we as homeopaths look at, we analyze, we find the right remedy, and, we cure them. And I found that this, what I call the allopathic infestation of homeopathy, to be something that's kind of always been there. many years ago, I was fortunate enough to speak at the Irish conference. And there, I was kind of, I suppose, a little bit naughty in that I got, it was a conference that was put together by students, but there was quite a few of the great and the good of the day were there in the back. So I just asked everybody, have you treated this illness? Have you treated that at the beginning of my piece? And I could see all the hands going up of many homeopaths I admired. And I spoke once again about the nature of disease, the nature of illness. But in the end, I quoted Hahnemann from his lesser writings, where he says, there are no named diseases. There are just sick people. And at the end, I said, so would everybody who put their hand up like to stand up so the students can see that, even you do not understand that this whole thing of diagnosis is an infestation within homeopathy. And unfortunately, it's something that's grown, I see more and more. It's like people seem to forget that an allopathic diagnosis is really, it's just a name for a symptom or a set of a very small number of symptoms added together. And knowing the name of something does not help with cure, but it can prejudice the way a person takes a case because it can weight the way they do it. And at the end of the day, it is the symptoms that give us the true picture of the illness, not the name that it has been given by an allopath. And it's something that I've noticed in some of papers that I've read recently, that there is the allopathic naming of the disease and then all the diagnostic information from the allopathic point of view and a tiny little bit of homeopathy, whereas it should be completely the other way around. It should be a massive piece of homeopathy describing all the symptoms, looking at all the different aspects of the case, looking at the analysis, and then, the remedy, and then what happens afterwards. And at the bottom, a very tiny, this is what the allopaths called it. Yeah. And this is how homeopathy should, I believe, be done, and how papers on homeopathy and the treatment of illness should be put out there for students, that they see it homeopathically, not allopathically. Now, when we look at all of these things that I've spoken about and Hahnemann's idea of the unprejudiced observer, to remove the prejudices of self and of systems and the removal of thoughts and intrusions that shouldn't be there when we are taking a case. It's often been said that the homeopath should be like the empty vessel, that we are or should be nothing more than the dynamic entity that allows for and draws out the energetic and physical manifestation of the disease in the patient. So it's almost as if we are nothing in the room. They are everything, and they will tell us all that we need to know, so long as we do not fill that space with ourselves. And as I'm sure you all would realize, there are many who would consider the case taking as part of the art of homeopathy. And this is true. I would agree with that, no problem at all. However, they mistakenly believe that they're the artist. That within the art of homeopathy, the homeopath is the artist. And that is most certainly not the case. It is the patient who's the artist. The homeopath should be nothing more than the blank canvas that they paint their symptoms upon, so that we can then truly understand what is going on with them. And this idea of the homeopath being the artist or whatever within case taking, I think is one of the things that can often also prejudice the taking of the case, because as I've often pointed out, that many homeopaths attempt to be the cleverest person in the room when they're with a patient, that they want to be the one who knows everything, or certainly wants the patient to believe that they know everything. And this is clearly not going to be the case. The patient knows their disease. They know everything. We know nothing. And so it's important to have that humility, that sense of, I am here to learn. Every patient is my teacher. And being able to just access that wonderment of self when you are there and a person is trusting you with their deepest, darkest secrets, with information that they have never told anybody else. And you have the capacity, if you listen and if you work properly and you avoid your triggers and projections and assumptions and all these other things, and please never have systems, and allow yourself to absorb this wonderful information, you have then the ability to create, as we find in that wonderful first aphorism of Hahnemann, we have the ability to create a rapid and gentle, permanent, or, to cure the sick, rather, a rapid, gentle, permanent cure. And it's, I believe, such a shame when I see homeopaths who are working so hard, and they are making these simple errors that's preventing them from fulfilling their greatest role, their true mission to cure the sick. And I hope from highlighting these things that will raise some students. It will raise their idea when it comes to taking a case, that every individual must be treated in a totally individual way, that anything that they think while they're doing a case, just put it away, just put it to one side. Any assumptions that you have, acknowledge it, just acknowledge it and put it away. But also never think that you have got the case. Never think, yeah, I've got this, it's absolutely sorted, I know everything. Because you won't. What you will have is what the disease state, will permit you to know. And this is where, if we're working without prejudice, we're working in that unprejudiced observer way, we can see when the disease state is still hiding information. It's people are going through the motion of wanting a remedy, but not always do they want cure. They want to feel they have done something. And so when we can see that these things are being hidden, then we're in a position to ask the right question that will open up the case. And that comes with experience and practice, yes, but it also comes with self-awareness and self-work. And every homeopath, I believe, needs to constantly be working on themselves, working on their own perceptions, being aware of any issues that come up for them in their lives and dealing with those things so that they are in as healthy a place as they can possibly be when they are interacting with their patients, so that they can gain this information and cure people. And this is something that, I feel very strongly about, because, as I said at the beginning, without the case, there is no homeopathy. All the materia medicas and repertories in the world mean nothing without the case. And I think that case taking is something that students should be encouraged to do under supervision as early as possible, so that they can make their mistakes, so that they can make their assumptions, they can have their triggers and their empathy, and that they can learn to move away from that, so that when they step out into the world as a homeopath, they're ready to go at a higher level than perhaps even some of those teaching them. And I've always, in myself, when dealing with students, tried to impart knowledge and information that will raise them to a point where they are higher than I was at that point in my career, because they're the future of homeopathy. They're the future of homeopathy being done correctly, where we don't have systems, we don't have people mixing remedies, we have people going out there as classical homeopaths with a true self-awareness and able to just get people well again, which is at the end of the day, that's all of our jobs. And really, if you've got questions, I am more than happy to answer them at this point.
Yeah, thank you, Bray. This was an insightful session. We have a few questions from the students. The first question comes from Dr. Nidhi. She wants to know that, if a case of allergy comes to you and you've prescribed for the symptoms of the patient, and the patient shows improvement. Now, in the second visit, the patient comes to you, and he says that while in the initial prescription it was improving, and okay, I'm so sorry. This is from Dr. Pranati. So you gave the right remedy and the patient was improving. And, everything about the patient was improving, the appetite and the thirst and everything. And slowly amelioration of complaints was there. And then in the second visit, they said that, they have developed allergic reactions to other physical agents.
Okay.
So then how do you approach such a case? This is Dr. Pranati.
Okay. Well, Firstly, to be honest, I would not say that the first remedy was the correct remedy. What we're looking at there is from what I can gather, is that there was an amelioration of symptoms, yes, and then when the patient came back, they had new symptoms in a similar way. So it was new allergic issues. The crux of the case is allergies. Yeah.
Yes.
So an allergy, as we know, occurs due to a reaction to some pathogen that's there. Now, if it changes from one thing to another, it hasn't changed. It's still an allergy. So if you give a remedy and the initial pathogen is no longer an issue, but a new one is, well, the dynamic derangement is still in place. So therefore, I would say that the remedy given was incorrect. It was palliative. It was not curative, because a curative remedy would remove that reaction or allergic reaction to any of the pathogens, because you are no longer in that heightened state. So that would be my answer to that. Go back to the case and find the core of what is causing this reaction, not what they're
So, Dr.
reacting to.
Pranati, I hope you've gotten your answer. Sir says that you need to get back to that patient, take the case once again, and reconsider what remedy you've given. So, probably this remedy was not the right remedy because allergy is very much a part of your patient and it is still there despite whatever remedy you selected. So no matter, irrespective of to what agent has been causing this allergy, it is very much there, and you need to retake the case. Next, we have a question from Dr. Nidhi. She says, "Sir, what to do if the patient mentions one single complaint every time he's repeating the same symptom?" So I think this refers to this is in context of what you told us, that we need to be unbiased, and once patient says this problem has been there since some event in the patient's life, and then you need to inquire more and more and go deeper into it. So she is asking you that if one person has been repeating a single symptom and repeatedly saying, so should we be giving emphasis to that, importance to that, and relying on what patient is saying?
So if I can understand this correctly, a patient has come with just one symptom and just keep saying for each question they go, this is, I only have this, I only have this.
No,
Or
Bray, I think I'd like to interrupt in between. She says there are a number of complaints, but the patient has been emphasizing upon just one single problem that has been disturbing the patient and
okay.
neglecting others. The patient is not, she has just mentioned once about the other complaints, but her emphasis is very strongly on one particular complaint. Then do you take that complaint as the main complaint?
Um, it would be arrogant not to, because the patient has come and they are saying, this is really what I want treated. This is my issue. So we have to take that into consideration. We have to give that weight, because this individual is asking for help with that. But what we must do is try and find the fundamental cause of the issue. If we cannot, then we must try and find a symptom picture around that issue that then we can gain a deeper understanding and therefore find a better remedy. in the very worst of circumstances, where all of those things are impossible, then the thing is just we have to let common sense rule and go, okay, I'll prescribe for you for that condition. Yeah. And what then tends to happen in such situations is that the patient may get some amelioration from that symptom. When they come back, we are then more able to get them to give us more information about other things and therefore give them a correct constitutional remedy.
Better remedy, yes.
Yeah. So sometimes we have to dodge and weave sometimes based on the patient and the way that they are. It's not ideal, but it's part of the job.
So, okay, so ultimately, your patient's mental peace and some symptoms that are disturbing your patient, ultimately addressing those symptoms are the crux of your profession.
Yeah.
If I'm getting that right. Okay, and the second part of our question is, what do you do in the second prescription when the patient comes in the second visit and she has been saying that this particular complaint worsened?
Okay.
Then how do you take the totality and how do you go forward with it?
Right. So when you have a situation like that where you cannot get the information that you require, you've given a remedy, it's not just aggravated, the condition has become worse. So now we need to look at two things. Is that a natural progression of the condition? Or have you managed to give an antipathic remedy, a remedy that actually increases the pathology, which can occur more frequently than people think? And that's something then for the homeopath to look at. And sometimes we have patients where we are not the homeopath to treat them. And that can be as important as getting the right remedy. Sometimes somebody will come and you're just not their person. They do not wish to open up to you. They will stick and fixate on one thing, but they go and see somebody else and they're effusive with information. So on occasions, it can be in the patient's interests to say, quite simply, I can't get the information I require from you. I'd like you to see Dr. Such and such because I believe that they may be able to. And what that can also do is it can focus the mind of the patient. So they go, right, okay, well, I'm going to have to do more next time. And that will then enable them to find the recovery that they want. Is that?
So Dr. Nidhi, uh, according to Bray, it is more about the rapport that you build with your patient, and at times it's about interpersonal vibing also. If at times this is not the right time to be talking and to be extracting information from the patient, so you may want to call him once again at after a certain time interval, right? And at times you're just not the person with whom this patient connects well, so you may want to refer the patient to somebody who might be able to extract that information from this patient and get you the right information, or may himself deal with the patient. So next we have another question from Dr. Vikas, and he wants to know, we the classical homeopaths have this all everything about following Hahnemann and giving a permanent restoration of health and everything. So you also have an article on acute cases. So how do you go about dealing with acute cases, injuries, compression injuries, which require immediate treatment where consideration of similars and similia similibus is not how things can go forward. We have absolutely no time. Then how do you treat that case? How do you approach it?
I couldn't agree with him more. It's one of the things that I've always said myself. If I was in a car accident, I want to see flashing blue lights. I want a trauma team there. I want everything to fix me. But once that initial um, uh, work has been done, so that my bones have been set, my internal bleeding has stopped, and whatever, then I want a homeopath which will speed up my recovery and leave me um, without permanent illness that can often come from the allopathic treatment. So, yeah, the doctor is quite right in asking the question. But when we're dealing with an acute that needs a rapid remedy, it's not something where we will um, sit down and spend hours and hours trying to find the correct remedy. We find a remedy that we know to be most similar to those symptoms, and we give it, and we do get rapid and permanent restoration of health.
Yeah, thank you. So now next question is from Dr. Tomek. I don't know if I'm pronouncing that right. What might be the problem about the usage of homeopathic combination remedies, combined remedies, regarding the specific conditions such as patients who come with pre-diagnosed allopathic conditions such as hypertension or angina?
Mhm. What
So
is the
what might
problem
be the
with combination remedy?
yes. Yes. Why shouldn't we why wouldn't you recommend using combination remedies?
Because they're unproven. No proving has been done on the combination. If you, for example, many years ago, a combination remedy for fevers came out, I believe called ABC, which was aconite, belladonna, chamomilla, all in the same pot. Well, aconite and belladonna antidote each other. So you're looking at a pot of chamomilla. Um, the problem with combination remedies is that we do not know how the remedies interact. We do not know what that combination will do because a proving hasn't been done. Now, if people wanting to use combination remedies put their mixture together and then go and do a proving and then come back and go, this is what the proving shows, then fine, use it. But this way of going, oh, I will take a bit of sulfur for the skin condition. I'll take a bit of Nux vomica for the stomach condition, a bit of this for that, and this for that, and give that. No, no, there's no way we know what's going to happen. And that's the problem.
So, if a doctor prescribes in a way where he maintains a significant gap between two doses, two remedies. For example, like I'll take up the example that you've taken of say Nux vomica and say aconite or belladonna, whatever, and
Yeah.
we maintain we schedule our doses in a way that patient is taking Nux vomica in the morning and then another remedy in the afternoon and another one in the evening. Uh, what do you have to say on that?
Once again, it's a very correct way of giving remedies. So if the patient requires a constitutional remedy, then it needs one remedy. The person needs one remedy, and that will fix their issue. If you cannot find a constitutional remedy for your patient, then send them to somebody who can, or stop practicing, because the job of a homeopath is to find the right remedy for the patient, not to go, well, I don't really know, but I'll give them one of these and one of these and one of these, and well, we'll just cross our fingers and hope, you know? So no, it's not the way to prescribe at all.
Okay, so we have next question. Okay. How do you approach allopathically suppressed conditions? For example, repetitive parasitic infestation, ringworm
Mhm.
infestation uh, has been allopathically suppressed, and now the patient has is coming with genital warts.
Okay.
So, how
So,
do you treat that?
okay. To be honest with you, I think every single patient we see has been allopathically suppressed. It's an unfortunate truth when we look at the nature of illness today. Practically every patient has had a myriad of symptoms over time suppressed by allopathic medicine. So, as we would with any other case, we take the symptoms that are being expressed at the time and we gain an understanding of the patient themselves. So, yes, there's those physical symptoms, but we want to know what is going on uh, in totality with the patient. And we take the totality of symptoms and prescribe on that. Now, it may well be that some of the past suppressed ailment will come back, and then we prescribe upon that at a later date.
So, Dr. Niveta, you've got your answer there. Next question, sir, is from Dr. Uh, Shivatik Saha. So he wants to know, sir, if a patient is suffering from similar diseases and dissimilar disease at the same time, so this is from the Hahnemann's concept of similar and dissimilar diseases. At the same time, then how do we cure them in terms of homeopathy, with homeopathy?
Okay. So when you look at this idea of the sort of two diseases running, you must look at that. First of all, you've got two choices, two ways of looking at it. First of all, you can either look at what is the thing that is going to be most damaging to the individual and work with that. Or you can go, the totality of the illness or the totality of the patient is going to be somewhere in the middle. And we look for the remedy there. We look for that information in order to treat the whole person as they are. But on occasions, yeah, it can be difficult. It's one thing that's been said. Homeopathy was never told us it was going to be easy.
Okay. Okay, another question, Bray, is from Dr. Tomic again. Are tissue salts always to be used in accordance with constitutional remedy? I guess she wants to know whether they are to be used in combination, I mean, alongside constitutional remedy, or they can be used independently.
I have a read of my article in next month's Heritage. But yeah, I mean, to be perfectly honest with you, um, tissue salts should be prescribed as a constitutional remedy. In other words, if they're indicated for the patient, they're given. If they're not, they're not. There should not just be some blind kind of, oh, I'm going to give this because it's a system that I've been taught. And the very the truth of the matter is those that brought biochemistry into homeopathy said themselves that biochemistry is not homeopathy. So your answer is from their, you find that from their own words in my article.
And of course, they'll wait for your article in the next issue.
Exactly.
Then next question comes from Dr. Nivita again. Can homeopathic medicine be given to cure a case of cataract when the patient is a known case of renal failure and on dialysis? For whatever reason, the patient is on dialysis. So
Mhm.
would you recommend giving homeopathic medicine for cataract with which the patient is coming to a homeopath?
Um, yes, I mean it's going to be a difficult one to treat. Because if this is the first time they're coming to see a homeopath, they're already in quite a bad condition, and their pathology has progressed so far that now obviously it's affecting the eyes in quite a damaging way. That doesn't mean that if you can find the correct remedy, that it won't help reverse that or at least halt it. But we need to not just be focusing on the cataracts. We need to be focusing on the totality of symptoms and giving the correct remedy for that patient. And then we will see how that helps them recover in all areas, not just the cataracts.
Okay. The next question is from Dr. Abhishek Gautam. How do you deal with hypochondriac patients, sir?
Oh, there's many of those in the world. Um, as with anything, somebody who is coming and they are a hypochondriac, that is a part of their symptom picture. That is a part of the information that they're giving us in order to find the right remedy. So whether they're somebody who is a real stoic or a real hypochondriac, it really doesn't matter. What we do is we take that as part of their picture in order to help us find the correct remedy. And if you give the correct remedy, they will no longer be a hypochondriac. I'm sorry, I can't hear you, Dr. Rashi.
Uh, am I
Ah, there,
audible now?
I can hear you now,
Yeah.
yes.
Uh, okay, so this is about the standard format of case taking that we talked about in the
Uh-huh.
beginning, that the conversation should flow on its own and no standard format should be followed for case taking. So if you could throw light on that once again for Dr. Rao.
Okay, so there are some people who will go, right, I have a system of case taking, and that system means that they will say, ask questions about each area of the body, almost like the repertory, and will have very specific questions that they will ask with regards um, how a person feels or how they interact or react. Um, and as I said, often this is just inappropriate because, as I mentioned, if a patient comes with a lady comes with a sore wrist, why would you go down your list asking about her menstrual situation? She has a sprained wrist. So it's important to always individualize and never have a structure because we are not allopaths. And if you're going to use that, you may as well not bother taking the case and just hand them a questionnaire. And once they've filled it in, come back and pick a remedy. But you're not going to have the case.
And something that struck me when you were talking about this was that we'll be, as a doctor, we'll be more bent on asking the next question rather than focusing on the patient's answer. So you don't really want to do that in your practice. You want to let the question be open so that your patient can open up to you.
Exactly.
And Uh, okay. Sir, another question that we have is somewhat very rational. To what extent should a homeopath rely on lab reports, the test reports that patients bring in, and diagnostic tools such as imaging and whatever when prescribing remedies? So, like X-rays and MRIs and whatever, to what extent would you recommend relying on those modalities?
I there's a difference in the way that we work in the UK as a homeopath to say in India. We rarely have access to that information because the industry that is the allopathic system does not like us to have that information. Now, that aside, in many cases, it's maybe a way of seeing if your remedy is working. So, say you have an X-ray that shows some issues on the lungs, and you give your remedy, and the patient has another X-ray, and that issue on the lungs has now diminished or gone. Then you know that from that you've enacted a cure, but also you should know that anyway because the patient will go, well, actually, I can breathe now, and I couldn't 2 weeks ago. So they can tell you just as well as all the imaging and everything else what's wrong with them and whether they've recovered. Um, and if we go back to the time of, say, Hahnemann and Kent and Allen and Borica, they listened to their patients and got the information to cure them without the requirement for huge imaging machines. So it's not something that I would use in order to find the remedy, but if it was available to me, it would be of interest so I could see how it had worked.
Okay, so this is interesting because in India, all the doctors, be it homeopaths or be it Ayurvedic physicians or the conventional homeopaths, allopaths, everybody can ask the patient to get the reports, get some tests, and we can even advise tests and everything to the patient. So if you want to really check if anemia has improved with ferrum phos, you can ask your patient to get an HB tested.
Yes. Yeah, but
So
also do you see as well that, say, you've given the right remedy and the patient is now no longer pallid, no longer slightly breathless and
yes, of
tired.
course.
So, we know they've recovered, but it would be also somewhat worrying if a test comes back, and I don't know how it would work there, but a test comes back and it goes, oh, the anemia has gone. Therefore they are better. Yet they are still pallid and tired. And
Yes.
the cure hasn't actually occurred, you see. So it's important not to just rely on those tests. It's important to rely on the information the patient gives you.
Yeah, exactly. So it's more about the subjective feeling of the patient rather than what your papers say.
Mm,
And of course, there has to be a fine balance between the two things, especially in the Indian scenario where we have access to all that information and we can get things tested. So then why not use a modern modality? But of course, as classical homeopaths, people, Hahnemann relied on the symptoms, on the patient's feelings. So that's how a classical homeopath should go about it. Okay, any more questions? Please type in, because we have already overshot time. We were here till 9 p.m. and till 4:30 p.m., I guess, in Cornwall.
Yeah,
But
we're
we've
past
overshot
that.
time. We're taking too much of Bray's time.
That's
Now, meanwhile, Bray, I'd like you to talk something about your book.
certainly, yeah.
Yeah.
I've written a book called The Simplified Guide to Homeopathy, and it really occurred because of a challenge from my partner and editor, because I was complaining that there weren't books of quality for lay people with regards to classical homeopathy. And so Sarah said to me, well, why don't you write one? So that's what I've done. Um, I've taken all of the sort of jargon and complexity of language that we use in homeopathy. I've taken that out to just put in plain English, so that my aim, it wasn't to dumb down homeopathy at all, but my aim was that if you can read, you can understand the book. And that's really the point of it.
That's the book is amazing, because I have read the book myself, and I had a copy, but somehow I don't have it right now. It's somewhere in my shelf, and so it's just sheer by chance that I'm not having that copy right now with me.
Oh, I'm glad you liked it.
But yes, it was a good book, a good read indeed. And so, any more questions from people? Yeah, I think Bray, that's it. We can conclude.
Okay,
And
thank you.
yeah, so thank you for your time, and we'll look forward to the article that comes in the next issue of Heritage. And
Uh,
to all the audience out there, you can read Bray's articles on Homeopathy 360. We have a page dedicated to Bray Williamson. You can log in to Homeopathy 360, follow his page, follow his articles, follow his writings, because they'll be regularly coming up. And simultaneously, we have his articles in different issues of the Homeopathic Heritage. We have recently published his article, uh, and we will look forward to more such insightful pieces from Bray Williamson. So thank you, Bray, for your time, and
Thank you, Dr.
thank you all of
Ashi.
you. Yeah, so we'll take your leave now, and wait for the next episode of Beyond Boundaries with Homeopathy 360. Thank you so much.